Medical imaging is the technique and process of creating visual representations of the interior of a body for clinical analysis and medical intervention, as well as visual representation of the function of some organs or tissues. Medical imaging seeks to reveal internal structures hidden by the skin and bones, as well as to diagnose and treat disease. Medical imaging also establishes a database of normal anatomy and physiology to make it possible to identify abnormalities. Although imaging of removed organs and tissues can be performed for medical reasons, such procedures are usually considered part of pathology instead of medical imaging. As a discipline and in its widest sense, it is part of biological imaging and incorporates radiology, which uses the imaging technologies of X-ray radiography, magnetic resonance imaging, medical ultrasonography or ultrasound, endoscopy, elastography, tactile imaging, thermography, medical photography, and nuclear medicine. Functional imaging techniques is positron emission tomography and single photon emission computed tomography. Measurement and recording techniques which are not primarily designed to produce images, such as electroencephalography, magnetoencephalography, electrocardiography, and others, represent other technologies which produce data susceptible to representation as a parameter graph versus time or maps which contain data about the measurement locations. In a limited comparison, these technologies can be considered as forms of medical imaging in another discipline. Up until 2010, 5 billion medical imaging studies had been conducted worldwide. Radiation exposure from medical imaging in 2006 made up about 50% of total ionizing radiation exposure in the United States. In the clinical context, invisible light medical imaging is generally equated to radiology or clinical imaging, and the medical practitioner responsible for interpreting the images is a radiologist. Visible light medical imaging involves digital video or still pictures that can be seen without special equipment. Dermatology and wound care are two modalities that use visible light imagery. Diagnostic radiography designates the technical aspects of medical imaging and in particular the acquisition of medical images. The radiographer or radiologic technologist is usually responsible for acquiring medical images of diagnostic quality. Although some radiological interventions are performed by radiologists, as a field of scientific investigation, medical imaging constitutes a subdiscipline of biomedical engineering, medical physics or medicine depending on the context. Research and development in the area of instrumentation, image acquisition, modeling and quantification are usually the preserve of biomedical engineering, medical physics, and computer science. Research into the application and interpretation of medical images is usually the preserve of radiology and the medical subdiscipline relevant to medical condition or area of medical science under investigation. Many of the techniques developed for medical imaging also have scientific and industrial applications. Medical imaging is often perceived to designate the set of techniques that non-invasively produce images of the internal aspect of the body. In this restricted sense, medical imaging can be seen as the solution of mathematical inverse problems. This means that cause is inferred from effect. In the case of medical ultrasonography, the probe consists of ultrasonic pressure waves and echoes that go inside the tissue to show the internal structure. In the case of projectional radiography, the probe uses X-ray radiation, which is absorbed at different rates by different tissue types such as bone, muscle and fat. The term non-invasive is used to denote a procedure where no instrument is introduced into a patient's body, which is the case for most imaging techniques used.